As the country recovers from the COVID-19 pandemic, stakeholders have been urged to intensify support for healthcare facilities in the rural parts of the country. In line with this, the Families of Today for Tomorrow, a charitable organization by a Ghanaian couple based in Canada, over the weekend made a huge donation of medical equipment and supplies, including beds and PPEs, to the Baptist Medical Center in the Northeast Regional Capital Town of Nalirugu. The director of the organization, Reverend Dr. Ama Nkoma Owusu, explained the reason for the donation.
This time, we were told, and the need was told us that they really need beds. So, by God's grace, we went and sourced out, and he provided 20 beds and a 40-foot container load of PPEs at this time that we needed it. Last year we brought some PPEs. Even that was before COVID. Before COVID, yeah. We didn't know there was going to be a COVID, but God provided us a lot with PPEs, gloves and masks and everything, and we brought it. And this year, again, the Lord has provided. So we are just a conduit of organization that want to help humanity, and so whatever we receive that we know that it can be a blessing to our country, we bring it. So this is why we have done this, that many mothers that comes to the hospital that sometimes they don't have beds to sleep on, they can have, or they have critical patients. These beds are automatic, so it can help the nurses not to carry the patients and all that. So this is the reason why we have brought these to help the operations of the hospital.
Dr. Ama says there is so much need for healthcare facilities as well as other sectors in rural areas to be supported. She, however, calls on private individuals and non-governmental organizations to support the efforts of the state.
One thing I realize in Ghana, that everybody calls on the government. Oh, government come and do this, government come and do that. But the government alone cannot do. We are also government. We are part of the government. So let us all put our hands together and help one another, help the hospitals, help schools, help the children to become a better place.
Dr. Edwin Adai, the hospital administrator receiving the donation, says the organization is one of the regular and reliable donors of the facility.
This kind of beds is very, very good beds. And especially the ones with a double crack. When you get this kind of beds and you have emergency patients, some of them they can't turn, they can't sit, but you can trickle the bed